Proton therapy is most useful when we want to cause less damage to something on the other side of what we're radiating. For example, if we're radiating something on the left side of the brain and we don't want that radiation to go through to the right side of the brain and cause additional damage, proton is a good example of where that could be useful, because proton therapy stops essentially. It sort of hits the brakes. It doesn't go as far as regular radiation, which would tend to just go all the way through. And with children, there's a lot of places where we have growth plates in bones, we have different organs that are growing, we have a lot of vital places where we really don't want radiation to go in one side and out the other. Well, at this time, a lot of brain tumors are clearly going to be better treated with protons because of the nature of the brain and how things are developing in the brain in young children and the nature of where brain tumors are. But I would also include all the different tumors that occur along the spinal cord and the vertebral column, because a lot of times those are tumors that are not accessible to surgery. You can't take out certain vertebrae and still, be healthy. And so a lot of neuroblastomas, Ewing sarcomas, sometimes even lymphomas are growing very near the bones, for example, and there's others, that's just a small example. And those patients will also benefit from proton therapy because, again, you'd be radiating the tumor, but you won't have the radiation pass through and affect the spinal cord or the nervous tissue around it. You have a brain tumor and it's on one side of the pituitary gland, for example. If you radiate with protons and the protons do not affect the pituitary gland, then all the changes that occur with puberty and reproductive organ and growth and thyroid and all the things that need to be kicked off hormonally by pituitary hormones won't be damaged. Whereas if you use standard radiation and you radiate through the pituitary gland, then that gland will get damaged and you won't undergo normal puberty, for example. Children who are very young, say maybe they're 8 when they're treated, if they're going to live to 80, they're going to have 72 more years at risk for cancer. So that for that patient, not putting them at risk for 72 years by not having radiation of normal tissue is really important. I think that having proton therapy as part of our armamentarium is a really important tool. The more tools that we have that are finely focused, the better off we are. So the better drugs that are finely targeted, fantastic. And the better radiation that's more finely targeted, that makes it even better as well. So, and we already, surgery has already found ways of improving surgical technique. And so all of the things that we can do that more precisely target the cancer and leave the non-cancer tissues alone, the better off patients will be. And the more likely it is that they'll come out of their therapy without risk of additional malignancy and being healthy.